Hi, my name is Dr. Tae Chong. I'm an assistant professor at the Department of Physical Medicine and Rehabilitation at Johns Hopkins University. I have a second appointment with the Department of Neurology as well. I'm here with Mental Health Minute. Now, what is the issue I'm working on? I'm currently working on autonomic nerve dysfunction, or POTS, which stands for postural orthostatic tachycardia syndrome after COVID-19 infection. It seems that many, if not most, patients who have lingering symptoms after COVID-19 infection have POTS, or a form of autonomic dysfunction. Now, why is this important? I've been seeing a lot of so-called long haulers, or patients with long COVID syndrome, and most of them are severely debilitated for many months after they are completely recovered from initial COVID infection. And most times, the COVID infections that they had were very mild or asymptomatic. Despite that, they can no longer go to work or go to school because of severe fatigue, brain fog, and exercise intolerance, as well as palpitation and orthostatic intolerance. Now, at the same time, these symptoms can sound very non-specific and are frequently dismissed by many doctors. And as a result, these patients also suffer from not knowing what they have. Now, what are the findings of the latest research? Unfortunately, the research in this area has just begun, and there are not many findings to talk about at this point. However, I know there are a lot of research projects that have just started or ongoing in many major academic institutes like NIH, Johns Hopkins, and Stanford. And many of them are very much focused on the roles of autonomic nervous system, or POTS, in the long COVID syndrome. How those findings in the research help clinicians address these issues? Well, first of all, as I just mentioned, symptoms of long COVID syndrome can sound very non-specific, and their symptoms are frequently dismissed as being conversion disorder or psychological in nature. Therefore, a lot of them are referred to psychiatrists or psychologists without having appropriate underlying diagnosis of autonomic dysfunction. Now, psychiatrists and psychologists are very important in the care of POTS or long COVID syndrome, but it is important to understand that there's actual evidence of autonomic or sympathetic denervation in POTS or long COVID patients, because there are known treatments for them in addition to psychiatric interventions. And secondly, there's emerging evidence that POTS or post-COVID syndrome is immune-mediated in nature, meaning it may be an autoimmune disorder. So recognizing POTS after COVID infection may lead to the discovery of disease-modifying treatments for post-COVID syndrome, well, through more research. Now, that's all for me now, and this is Mental Health Minute. Thank you very much for your attention.